Hi, everyone. Today we're presenting our task analysis and chaining training protocol. This protocol is designed to help caregivers, parents, and paraprofessionals, as well as direct support staff, to teach multi-step functional skills in a clear and consistent way. A task analysis is the process of breaking a complex skill or series of behaviors into smaller teachable units. Chaining is used to link those smaller steps together so the learner can eventually complete the full skill independently. The example that we're going to be using for our presentation today is teaching a child to open a container, but the same process could be used for many daily living skills, such as brushing teeth, tying shoes, getting dressed, or washing hands. So task analysis and chaining are important because functional skills can be overwhelming if we expect the learner to complete the whole skill at once. By breaking down the skill into smaller steps, we can see exactly where the learner is successful and where they need more support. This is especially important for parents and caregivers because they are often the people that help the learner practice these skills during their everyday routines. Caregivers often need clear training on how to break down the skill, prompt appropriately, reinforce the progress, and collect simple data. This promotes consistency, it supports generalization, and it helps the learner build independence across natural environments. Also, in relation to our ethics code, we do have an ethical responsibility to provide effective treatment to our client. So it's our ethical responsibility as well. And here we have multiple types of chaining. So there are three main types of chaining. The first is forward chaining, where the learner completes the first step independently and the implementer helps with the rest of the steps. Once the first step is mastered, the next step is added. Then the second type of chaining is backwards chaining, and this is where the implementer completes all the steps except the last step, and the learner completes that final step. And the third type of chaining is total task chaining, where the learner attempts every step during each teaching session with prompting and fading used across the whole chain. So in our example, we're going to be focusing on forward chaining. So this means that the child is going to start by learning the first step, which is picking up the container with both hands, and then moving on to the next step. Now, for our target learner and training audience, the target learner is any individual who needs help completing a task, a multi-step functional task independently. So the training audience may include parents, caregivers, paraprofessionals, RBTs, and direct support staff. And those learners would be able to teach that skill to the student or the child. The purpose of the protocol is to teach complex skills in smaller, manageable steps. A task analysis helps the caregiver identify each step, and chaining helps the learner acquire those steps in a planned sequence until the full routine can be completed independently. And then here we have a few key terms that we'll be using during our presentation. And then materials needed, and we have our step-by-step implementation procedure. So when we're implementing task analysis and chaining procedures, the first step is to identify and define the target behavior in observable terms. So for example, instead of saying the student will get their snap, we would say the learner will independently unsnap the container lid and break the seal around the lid. This makes that skill more measurable. The next step would be to complete a task analysis by breaking down the skill into smaller sequential steps. So each step should be observable and in written order that it needs to occur. So for example, for opening the container, the steps would include picking up the container, holding the bottom, locating the lid, gripping the lid, pulling the lid to break the seal, continuing to break that seal around the edge until you're able to lift the lid off, settling the lid on a surface, and accessing the snack inside. So once the task analysis is created, the BCBA or the caregiver is able to select the chaining procedure based on the task analysis. In this case, we're using forward chaining. So the caregiver teaches step one first and then helps the learner complete the remaining steps and then adds the next step after mastery. So there are a few things to keep in mind here. When training caregivers, it is important to remind them that the goal is to build independence one step at a time. Practice should be short, positive, and realistic. Caregivers should use clear directions, wait a few seconds, and prompt only when needed, as well as provide the least amount of help necessary. Okay, and then here is our error correction procedure. So if the learner does not respond within 5 seconds or completes the task independently, the caregiver should stay calm, avoid repeating the directions several times, provide the least intrusive prompts needed, allow the learner to complete the step with support, provide praise if needed, and continue the routine. They should also collect data as well. So in this area, we have some troubleshooting tips and common implementation um, concerns. So some common challenges include the caregiver prompting too quickly, teaching too many steps at once, repeating the directions too many times, or using a skill that's too difficult. So to address some of these concerns, caregivers should wait before prompting. They should focus on the current teaching step, keep data sheets nearby for recording, use meaningful reinforcements, and reduce the demand of the learner if they become frustrated. Also, we have data collection procedures. So the caregiver should collect data during each practice opportunity by using data sheets that I will demonstrate in a moment with the correct coding. So if the learner performed independently, it would be noted as independent, P as prompted, E as error. And then there's also mastery criteria. So here is the task analysis sheet for those skills along with the codes that apply to each step. As well as we have a BCBA treatment fidelity checklist for the BCBA while teaching these steps, as well as the mastery criteria at the bottom. So next, we're going to be moving on to our role play. As a group, stop sharing. So as a group, we're going to be presenting the instructions. So the BCBA is going to be Kylie, grandma is going to be Jessica, mom is Camilla, and I will be Sally.
Okay, everyone. Today our group is going to be teaching the behavior skills training, and we're going to teach Sally's mom and grandma to how to use task analysis and forward chaining to help Sally learn how to open her own snack container. Before we begin the role play, I want to explain what task analysis and chaining are, why they matter, and why we are using BST to train mom and grandma instead of only giving them verbal instructions.
A task analysis means breaking a larger skill into smaller, teachable steps. Opening a container may look like one simple action, but it is actually made up of several steps, such as picking up the container, holding the bottom, finding the lid, pulling the lid open, and removing it. When we create a task analysis, we can identify exactly where Sally is successful and where she needs more support. Chaining is the teaching procedure we use after creating the task analysis. In chaining, we teach the steps of the skill in a planned order until the learner can complete the whole routine independently. Today, we are using forward chaining. In forward chaining, we teach the first step first. Once Sally masters the first step, we teach the second step, then the third step, and continue adding steps until she can complete the full routine independently. We are using forward chaining because Sally is just beginning to learn this skill. Starting with the first step holds her learn helps her learn how to begin the routine instead of immediately handing the container to someone else. This also gives mom and grandma a clear way to prompt, reinforce, and build independence one step at a time.
This matters for Sally's family because Sally has been handing her snack container to whoever is nearby whenever she wants it open. Mom and Grandma have been opening it for her, which is understandable because it's faster in the moment. However, if adults always complete the task for Sally, she does not get enough opportunities to practice opening the container herself. We are using BST because caregivers usually need more than just an explanation. They need to hear the steps, watch the procedure modeled, practice it, and receive feedback. Today's training will include 4 BST components: instruction, modeling, rehearsal, and feedback.
Here's the task analysis we'll be using for opening the snack container. So first, Sally will pick up the container with both hands. Then step 2 is hold the bottom of the container with one hand. Step 3 is locate the edge of the lid. Step 4 is grip the edge of the lid with fingers on both sides. Step 5 is pull upward on one side to break the seal. Step 6 is continue pulling around the edge until the seal is fully released. 7, lift the lid completely off the container. 8, set the lid down on the table. And finally, the last step is access the snack inside.
Since Sally is just starting to learn this, whoever is helping her will complete steps 1 through 7, and Sally will independently complete step 8, setting the lid down once it's off. The adult will use a full physical prompt on the steps they're completing for now, and they'll pair each step with a simple, consistent verbal description so Sally starts to learn the routine.
During practice, mom and grandma will give the direction, wait up to 5 seconds, prompt only if needed, praise Sally for completing the target step, help with the remaining steps, allow access to the snack, and record simple data. The data will be I for independent, P for prompted, and E for error or not completed. I'll be watching for whether you use the task analysis, allow Sally the chance to complete the current teaching step, prompt appropriately, provide reinforcement, and collect data. So now we're going to move into the modeling phase, and I'll be acting as the BCBA. So I'm going to model the procedure first. Please watch how I will give the direction, wait, allow Sally to complete step 1, and then help with the rest of the routine. Sally, open the container. Great job picking up the container. Now that Sally completed the current teaching step, I'm going to help her finish the rest of the routine. I'm helping her hold the bottom of the container, find the edge of the lid, grip the lid, pull upward to break the seal, continue pulling around the edge, lift the lid off, set it down, and access the snack. Because Sally completed step 1, I gave immediate praise and then helped her access the snack. The snack is the natural reinforcer. I would record this as I for independent because Sally picked up the container without help. If I had needed to guide her hands to pick it up, I would record it for P for prompted. Grandma, now it's your turn to practice. Remember, Sally is only responsible for step 1 right now. Give the direction, wait up to 5 seconds, prompt only if needed, praise her, help with the rest of the steps, and then record your data.
Sally, open the container. Pick up the container. Nice job picking it up. And now I'm going to continue all the steps. And finally, at the end, I'm going to give Sally access to her snack.
That was a really good first attempt. You gave Sally a clear direction, waited before helping, and used a prompt when she needed support. I also like that you praised her right after she picked up the container and helped her finish the rest of the routine. One thing to adjust is the type of prompt. You used a gesture and then added a verbal reminder. Next time, try using the least amount of help needed and avoid adding too many extra words. For example, after the direction, you can wait, gesture towards the container, and then only help if she does not respond. Overall, you followed the forward chaining procedure well because you focused on step 1 and helped with the remaining steps. Do you have any questions before we have mom practice?
No, thank you for the information.
Great. Mom, you're up next. It's your turn. Remember, Sally should complete step 1. Your job is to give the direction, wait, prompt only if needed, praise her, help with the rest, and record data.
Okay, Sally, let's open this. There, it's open.
Thank you for practicing that. I know it can feel more natural to just quickly open it, especially when you're busy or when Sally wants a snack right away. You did a nice job staying calm and using a positive tone with her. The part we need to adjust is that you completed the first step for Sally. Since we are using forward chaining, Sally needs the opportunity to complete step 1, picking up the container.
Mm.
If we pick it up for her, she does not get to practice beginning the routine. The goal is for her to learn that she can start the process herself instead of immediately handing the container to someone else. Let's try it again. This time, place the container in front of Sally, say, open the container, wait up to 5 seconds, and let her try to pick it up before you help.
That makes sense. It's just faster when I do it.
I completely understand. At home, it feels easier to do things quickly, but giving her that short pause helps her learn the skill over time. Even if it takes a little longer now, it can lead to more independence later. So let's practice one more time.
Okay. Sally, open the container. Great job picking it up. And now I've helped Sally and I've given her access to the snack.
That was so much stronger. You gave her the direction clearly, waited before helping, and allowed Sally to complete step one independently. Your praise came right after the correct response, and you helped her finish the rest of the routine so she could access the snack. That is exactly how we do forward chaining. As Sally becomes consistent with picking up the container, we can move to step two and teaching her to hold the bottom of the container while still completing step one independently. Great work today. We used a task analysis to break opening a container into smaller steps. Then we used forward chaining by teaching Sally the first step and helping her complete the rest of the routine. The most important things to remember are give a clear direction, wait up to 5 seconds, let Sally complete the current teaching step, prompt only if needed, praise the steps she completes, help with the remaining steps, allow access to the snack, and record data as independent prompted or error. Once Sally completes step one independently across 3 consecutive sessions, we will begin teaching step two. The long-term goal is for Sally to complete the entire container opening routine independently. Thank you both for practicing today, and we will check in again to review the data, answer questions, and decide when Sally is ready for the next step.